I don't see there we go. Okay, we are officially recording. Welcome to our what month is this? March MARG meeting, the Multidisciplinary Advocate and Researchers Group. We are so glad to have you here today. My name is Sharayla Haynes. I'm the Community Partners Project Manager with
Turn it
Frontiers, which
down. Sorry.
is our CTSI here. We're housed in KU, but we are a part of several partner institutions across the Kansas City region on both sides of the state line. I always say this intro because these are on YouTube. And so if someone happens to stumble on one, I want them to know who we are and what we do in case anybody was ever wondering, like, why does she do this intro every time? But yes, so we are a mighty group of multidisciplinary researchers and advocates, community members, all the things. We have people popping on and off throughout our meetings and throughout the duration of the year. So we just have really exciting presenters that try to bring in the community aspect and hopefully some best practices that we can all learn from. Um, I'm going to open up with some updates from Frontiers. So we have officially started recruiting for our community advisory board. I will make sure that everyone receives that flyer and that information to our Red Cap survey. If you know of any community members, excuse me, that are interested, please send it to them. I do want to and make sure that you know it is not required that these people have a ton of experience. In fact, we would like to have a plethora of community advocates, some that are really experienced in the research space and some that are not, so we can not get in a rut of doing the exact same things the exact same ways. And so it's really important to us to have diverse community advisory boards. And I know that that is a buzzword, but really and truly representing different parts of the population within the Kansas City region, both Kansas City, Kansas and Kansas City, Missouri, and the surrounding regions, because that's what we serve. Unlike other CTSI hubs, like on the, New England states, New York has like three. Just the city of New York has three. But here, we are the only hub within like four states. And so while we're not responsible for those states, we still want to make sure that our reach is long and wide. So we want to make sure we have representation from all across the Kansas City area. So that has started. I will make sure that you get information for that. And also, Jill Peltzer, Andrea Badley Ewing, two of our awesome community members, and myself have worked on this community academic partnership series, which is going to be a collaborative series of different things. Like, for an example, if we can find a solution to when there are grants that may not be large enough to pay someone that is the most experienced person, maybe there's a tutorial on how to do that. Once we find out what that tutorial is, then we'll teach it. We'll record it. You can, review it and take that course. Likewise, if there are ways that we can best serve our community advocates in ways that may not be obvious to us, we can do that. So right now we are taking a survey to see who is interested in presenting, what topics they're interested in presenting in, and we hope to start this in the fall of this year, that we actually start this series and get this conversation going and include people from all of our partner institutions. So I will make sure that you receive that Red Cap link as well. And my final announcement, and Alan, if there's anything I'm missing, please let me know. My final announcement for Frontiers is that we are hoping to have our May meet and greet in Lawrence this year. And so I'm really excited for that. I have been working with our partner, Emily Ryan, and she's in the Community for Service Learning, and she is really excited for us to partner. So we want to do something with a museum in Lawrence. We already have an artist planned to perform for I can't think of the name of the month. It is Asian American Island Pacificer Heritage Month. I wanted to say it the right way. So we have an Asian American Island Pacific performer. She's really, really good, and she's been hired by a lot of a lot of corporations. And so we're looking forward to that. So be on the lookout for that. We have not ironed out the details, but it will most likely be in Lawrence in May 14th. It should already be on your calendars. Oh, there's Emily right there. I talked her up. I have to tell her this while she's on. Emily, I don't know if you can hear me yet. You're probably connecting your audio, but I just talked you up. I was talking about our meet and greet, um, and hoping that we can get that all finalized and ironed out to be in Lawrence in May, and that I will let them know all the details as soon as I have them. But I was just sharing with them about how we have a speaker or a performer of Asian American Island Pacificer for Heritage Month in May, and that you and I have been working together to iron out those details. So if there's anything you want to add to that, I don't even know, you didn't know what I said, but that's
well, the only thing I was going to say is that I've invited, and I'm going to continue to invite, a lot of new faculty here who are at the intersection of arts and health, like in architecture and design and different areas. So trying to kind of like reinvigorate partnerships where they may happen. So
that's the goal for me right now, is to not only establish and strengthen, but establish and strengthen our partnerships and relationships with people that I think would really benefit from being a part of MARG and knowing more about what Frontiers does, because there's a information gap. People don't know who we are and what we do, and so we're trying to decrease that gap. Um, are there any Frontiers announcements that I am forgetting or anything that I need to include that anyone? Alan, I'm looking at your square.
The only thing I wanted to say is we had a external advisory council or external advisory board visit to Frontiers, 5 or 6 folks from other CTSAs around the country, and we kind of got a glowing report for our community engagement activities. And so everybody should know that of course, we talk up all the great work all of you do, and we talk about MARG, and we talk about things that we were working on and want to do, but we got some good feedback and some suggestions for new things to do. But everybody needs to toast to Sharayla, because I think it went awesome and she impressed everybody as usual. So was exciting.
Thank you, Alan. It really is a group effort. Mariana, her presence being there and emphasizing what Juntos does, having one of our Broderick Crawford Award winners present on what he is using some of our funds for. It really did put into perspective these building blocks. We just have these building blocks, and yes, I am reminded when I meet with other community engagement specialists at other hubs that we are really doing the work here. So we should all be proud of what we do. The meetings that we're having that just seem like they're meetings, and we're coming up with all these ideas, and we actually are putting the work in. So I am proud of us. And Tamara, sorry, I see you have your hand up.
No worries. So I just wanted to shout out to folks who participated in the conference, and I wonder if we want to talk a tiny bit about that, since I don't think we've met since then.
Yes.
Who participated? I will say I did a speed mentoring event, and it was fantastic. It was very powerful. People cried in my meeting. I'm going to tell you that right now. Oh yeah, there is a need for mentoring. It was intense. People feel like they need support. So I think if you could incorporate that always in the Frontiers conference, even if it's not about mentoring, I made some connections. High school students reached out to me as a result. Like, it was so cool. You just never know. And I just thought it was a really nice space to connect with people. So
thank you for saying that, about including that into future symposiums. We obviously are downloading all the information from the symposium still. If you if you did attend and you get that survey, please fill it out, because that is how we get better. That's how we include the things that matter and that we discard the things that don't. So yeah, I know that Mariana was at the symposium. Was anyone else there that's on the call? I don't think.
Oh,
Rebecca was there.
Of
I was there as a mentee at that event. I completely second Tamara's comments about the mentorship and the speed mentoring. It's very, very needed. And the staff, mentoring for staff, was also part of that, which I think is a huge gap. And I was really glad to see that as well.
And Sharayla, maybe for next year, our group, since we have such amazing people, should try to have a panel. I think I kind of learned about it. I just got on it a little too late, but I think we should show the world what we're doing in this group, because I know if more people knew about us, they'd be here. right now. That's my opinion. But
I really like that idea. And I think that we have built enough social currency to be able, once you get a glowing report from our EAC, then it's like, hey, you guys can do whatever you want to do. So I don't want to say we were the shining star of the EAC, but you know.
give credit where credit's due, Sharela. Come on.
Give credit where credit is due. What can we say? I really like that idea. I'm going to pass it on. I don't know what the theme is for next year, but I don't think it matters because we can fit in everywhere and anywhere. So yeah, I will definitely make sure I pass that on. I agree with you. I also want to make sure that our Broderick Crawford Community Partnership Award winners have a space for posters next year so they can show where they use their money if they so choose to. It's not a requirement, but if they would like to present a poster, I think that would be great. And in years to come, I hope to have a panelist of award winners to talk about what they've done as well, like actually presenting their work. But that's a personal goal of mine, that we can show what community engagement really does in the health space. So unless there is anything else we should discuss, I think we should move on to our awesome presenter today. Is there anything else going once? Okay, I'm going to pass the mic over to Tamara. Thank you.
All right. Hi, everybody. I'm so excited to introduce Lety Nunez Argote today. She'll be speaking. Well, I'm going to let her tell us what she's going to speak about. I'm going to give you a little biographical sketch of her work. So Dr. Nunez Argote is Clinical Associate Professor with the Department of Clinical Laboratory Sciences at the University of Kansas Medical Center, where she teaches undergrad and grad level courses in lab sciences. She trained as an MLS at the University of North Carolina at Chapel Hill and completed a master's degree in public health at the Instituto Nacional de Salud Pública de México, followed by a doctoral training at the University of Kansas. Her current research interests include health and well-being of health professionals, particularly medical laboratory professionals, and hopes to characterize their experiences and incorporate lessons learned into effective, individualized, and timely interventions. So I'm really thrilled to host Lety here today so that we can learn more about her work. Thank you so much, Lety.
Thank you, Tamara and Sharela, and everyone for being here. I'm going to go ahead and try to share my screen, the correct one this time, as opposed to every other time. I hope you can see my presentation.
Perfect.
Excellent. And that's great. And I am so thankful for this time and this opportunity to share with you all what I have been able to find with speaking with and having the feedback from my colleagues in the laboratory world. I have been able to reach out to a number of people across the nation for the last almost is going on 3 years now with my research. Today, I wanted to have the spotlight on our laboratory workers in rural areas and non-metro areas, particularly the ones that responded to my request for more of their experience on the COVID pandemic and how that went for them. And so today, that's kind of how the conversation is going to go, but I do have some additional background information. So first things, of course, let me see if I can navigate. Right, there we go. Disclosure is I did receive funding from a couple of places to be able to perform this research. The one that I have here is from the Healthcare Workforce Center of the Midwest, which is located at the University of Iowa and Washington University. It's a collaborative center that will focuses on occupational health. And so their assistance with this grant allowed for me to collect a ton of data and was able to look into the needs of this group. To start us off, just because I like to go from like big to small and kind of give us a framework of what we're looking at is I was kind of thinking about what does rural health look like and what does rural hospital experiences look like currently, especially in Kansas. And so I found this report from fresh out of the presses that speaks to the imminent danger that our rural hospitals are in. I worry a lot about our rural hospitals, clinics, and health facilities because that is where my colleagues in the laboratory work. Mostly other practices can exist, other health providers can be around, but without a place where they can work, laboratory workers are not going to be there, right? They have to have a lab, they have to have tools. And so I looked at what the outlook for our rural hospitals was. And this report, they said that 10 rural hospitals in Kansas either closed or they got rid of inpatient services in 2023 alone. And that 89% of the remaining ones were operating at a loss. So this is a very terrifying kind of palpitations went around when I was looking at this information. And they also were talking about how 30% of these rural hospitals may be in danger of either closing or eliminating patient services to survive in this year, like in 2024. And so that the report went on to explain many reasons why this is an ongoing trend. We all know that yesterday, I believe there were hearings about Medicaid expansion again for the first time in 4 years, which all of the fingers are crossed on my end for that to happen because I hope that would move along. But that's good because that would actually hopefully infuse some needed cash to those places. And they also talked about COVID as far as how a lot of the funding and resources that were going back and forth have affected these rural practices. And then they also talked about some of this being based on the cost-based reimbursement for Medicare Advantage plans and the changes, like people are starting to go for that as well, and the implications that has. So those were some of the big picture factors that were kind of influencing this trend in rural hospitals. And so I worry about rural hospitals because my colleagues work in rural hospitals and clinics. And so without them, I mean, it's just kind of terrifying. So once I looked at that, and now that we kind of have a picture of what the practice setting is for my colleagues, for those of you who do not know, who are these laboratory professionals that we're here to kind of hear this other person talk about? And I like to describe us as a very heterogeneous, very multi-generational group of people. We are by the numbers, one of the largest cohesive groups of workers in healthcare, aside from nursing and physicians. So it's about almost over 400,000 people that work in that laboratory space in many different capacities. And so we are quite a big group, and we do a lot of different things. But basically, our focus is on the analysis of biological samples to provide results and to help with treatment and prevention of disease. That's pretty much what we do. And so one of the biggest concerns we have had for every healthcare profession, but obviously in the laboratory as well, is the recruitment and retention of laboratory professionals. Particularly in this case, I wanted to talk about rural settings. A now really old study for me, I mean, over 10 years is a long time. In Tennessee, they actually went out and looked at rural recruitment and retention. And so they talked to a bunch of rural managers and asked them what were their concerns, what seemed to work, what wasn't working, how they went about doing that. And so obviously, I feel like we all know, especially in a state like Kansas, that rural origin is associated with rural practice. So people who are from areas that are not metropolitan areas, who have the ability to go back and practice there, more likely than not will, and especially if their training happened near their hometown. And so that was true then, that is still, I feel, true now. One of the problems with the hospitals themselves and practice for laboratory particularly is a lack of opportunities to practice different skills. Since these laboratories are smaller, they don't have as many different patients that have what I hate to call interesting diseases. I mean, if somebody has an interesting disease, that's bad, but it's cool when you're a scientist. And so that lack of variety may become somewhat of a problem. Also, because they can't develop their job skills as well, they have lack of opportunity for development of their skills because of that lack of, just variety. Then there was also the frustration over lack of funding and outdated facilities, meaning that because of these problems that we have with smaller practices and in Kansas, for example, no Medicaid expansion, there's not a lot of money going into these places, and laboratory testing is expensive, especially if with our switch from cost for service to actually just, are people getting well? This is how I'm going to reimburse you. Reimbursements are quite low, and they've been dropping in the past also 6 years after the passing of the Affordable Care Act and the subsequent passing of the what we call PAMA, Protecting Medicaid Access to Medicare Act, which has been decreasing the reimbursement for laboratories about 10 to 15% every year. And so reimbursements being lower, that means that you don't have any money to update your equipment and have additional services. And so when I was looking at this, the motivation for my study in general, just big picture, was to look at all of these different concerns, work related, but also health related. And so actually nobody had really ever asked themselves, like, how is the health of laboratory professionals? Like, how are they doing? Just in general in the United States, which I was baffled by. Like, nobody had actually gone and asked them, how are you doing? Which, so let's do it, I said to myself. And so that's the motivation for the study. It was an overall, like, let's just go ahead and ask a number of questions. And why is it that I care about their health and their well-being? Because it is known that if a professional does not do well and they're not doing well in their job, they will leave. And especially with this highly trained people, anyone in healthcare professions, but for laboratory professionals, if they leave, that can lead to a lot of different problems, delayed testing, interfering with the quality of care for our patients, decreased access for needed medical information because tests have to be sent out to some other state, and that takes time, and then increased financial burden because the tests are going to be more expensive if they have to go far away. And so for me, that was kind of a big deal for asking these questions. And so the last part is, of course, not saying it's all problems. It's let's find some solutions. What are managers and administrators and people in these facilities thinking about or doing? What do the workers perceive that is happening for them that they feel like they want to stay, that this is working for them, that they're happy? Because administration and management can be doing a number of things, but the way it lands on the workers is so important. And a lot of the time you see surveys out there that ask the management, like, what are you doing? That's great. But you also want to ask the workers, like, what are the things that management does that make you feel better versus not? So that was something that hadn't been done in a while for our population as well. So with those in mind, the last thing that I wanted to incorporate, I did that's a study that I did my dissertation on, but I actually left COVID out. I didn't actually ask any COVID questions as part of my dissertation. However, COVID did come up because it was happening. And so once I started gathering this information and seeing how COVID was emerging from the people that were participating, then additional kind of questions came in my mind. It's like, what is going on with their experiences specific to COVID? And then how has the pandemic affected them, particularly something that I didn't think about before, and now I do, family, work-life balance, and how that went for them. A lot of there's a lot of research and a lot of articles from a lot of other health professionals that have documented how that happened for them. But actually, I don't think there's anybody that specifically has looked at the population. So it was like, okay, let's ask them. And then obviously, again, I still want to know what the management has been doing for them as well. And so with that in mind, in 2022, I actually sent out a smaller study with the people that I had already been in touch with, and to see how can they inform this additional questions that I had. And so the methodology for this part of the study was using my database of participants. I had about 520 who actually completed my first arm of the study. And so I reached back out to them, and I was doing a targeted look back at people who had reported to work in non-metro areas. I did want to have a little bit of more representation of that as well. but just in general, anyone who wanted to participate and tell me more about COVID. And then if they had a friend or like somebody they knew, they could just send it off to them. And this was just an electronic written interview. So they was captured. They would just type their answers and send it back to us. And then the analysis was mostly qualitative because these were open-ended questions that talked about COVID. And then also I captured some demographics. So as we go through the results, I did want to make sure that you're aware. I am going to provide direct quotes because they actually wrote it down for me. They were so nice. So nice to have the population that can do that for you. And so I'm going to just provide you with what exactly they typed on those answers. Now, just a brief look at what they look like. This last group was there were 79 people who responded with interest, but we were only able to capture 76 mostly complete answers based on the time frame that we had. And so that group was actually quite a good mix of people from racial ethnic minorities. It was surprising we had lower female response rates. Being that the population of laboratory professionals is about 65 to 70% female on any given day, I guess. So then we also had younger people responding and people mostly who are in the testing personnel. Now, for those of you who don't know, the College of American Pathologists classifies laboratory professionals based on like who's a director, who's a supervisor, so on. But the majority of this, almost 50%, were just people who actually are doing tests. And then, interestingly, most of them had been in the profession less than 10 years, which are the people we want to keep. Let's keep them there. And they were actually 55% of college degree, and they had laboratory certification. Laboratory professionals can qualify for laboratory certification, but not all areas of the laboratory require a person to be certified in order to practice. So it depends on what they're doing. And then last but not least, I was very excited. Out of all the ones that I could actually find a county that I did ask, and some of them just said, I'm from this place. And I'm like, I can't tell what county you're in. So I was able to figure out that about 66 of them who did provide information either had provided a county that was in the non-metro ROOC code, or if they had reported that they worked in a rural laboratory. And that was something that from now on, lesson learned for any of you. If you're using the rural urban continuum codes and county information to ask people if they work in a rural hospital, I did find that a few of these people were in code 1, but their clinic was all the way out, like all those at the edge of that code. And so their rural clinic was truly rural. It's just that they were not in a code area that was rural. So I'm glad I asked both questions because I was able to figure that out based on that information. Lesson learned here. And that was a good proportion of them. 38% of these individuals were in that category. And so with that, I did get 25 participants who were classified as dark metro or rural area. Most of them were from Kansas, I'm assuming, because they see the University of Kansas and they're very excited to tell me about it. But I did get a nice, interesting spread mostly. I got a ton of people from California and then quite a few from Northeast states and then a couple around the area as well. And as you can see, the population very similar to what we just saw for the group as a whole. However, I did find that a lot more of them had graduate degrees of these people working in rural areas, which I was surprised by and interested with. The other thing that I did find is a lot of them worked in molecular microbiology, which were the people who were a lot of dealing with the COVID tests, makes sense. And then that a lot of them had been in the role for less than 5 years, which is quite common in rural environments. People don't tend to last too long. Then we had the next one with 5 to 10, and then very few 10 or more years working in that same role. And so with that being said, let's see what they talked about. So very briefly, what things did I find looking at the input from my participants? Out of many of the things, there were a lot of things. We don't have that time. So I'm just highlighting the two that I thought were the most critical and interesting for me. And I think in general, the impact of the pandemic for them on these three key issues, and then the management practices, of course. And so, what was the impact of the pandemic on this professional's health? So, of course, the first thing that we worry about is mental health. A lot of workers are usually healthy physically, so they can go to work. However, the majority of people reported stress. Stress and anxiety were the top two concerns that they had. A few of them mentioned burnout as an actual word. And then quite a few others, which I was surprised by, depression and exhaustion. Depression being quite concerning because you have this mix of anxiety, stress, depression, and then exhaustion. Like people were just tired. And so I had a quote from this person is just too tired to do anything outside of work, which is a huge concern in this environment for a worker. And also one other person who was voicing their concerns, like a lot of health workers died and treating patients, and this caused some mental trauma. So this people, even though we're not a bedside or patient facing necessarily profession, we were acutely aware of that trauma for our colleagues in the medical professions as a whole. The other thing, obviously, in impacting health is your physical health. There were a lot of infections too, even within the laboratories. There were complaints of people being allowed to congregate in areas or not having the ability to separate from patients who may be infected. And then also, injuries, headaches were quite a report that was quite interesting, mostly because in conjunction with exhaustion or anxiety. And then there were quite a few people that did become sick. So, for example, in this case, this person reported that they contracted the virus and their colleagues did too. And one of the things that is the most concerning here is we couldn't work. And so when you have one health professional down in a laboratory where you only have 3 people, now you have 2 people. And so that is a big concern because the staffing of laboratories, especially in rural areas, tends to be quite reduced. Then we have work-life balance. That was another thing that I really, really wanted to learn more about. And so one of the biggest things, obviously, concerns with making their family sick. That was obviously earlier in the pandemic, but trying not to get too close to their family. If you're not sure you're going to get them infected, there were a lot of reports of people not, losing touch with their families actually leaving the location, which brings me to this next one, which was not spending time with their family. And there were these 2 key quotes that I thought really encapsulated with the feeling of the group was colleagues struggling with childcare, being that schools and daycares were closed. So as professionals will have to go to work no matter what, because the lab doesn't close and you're on call and it's in the middle of the night, you have to go. And then this one person actually reported, my wife threatened with divorce because of the fear of being in that environment and working, coming home and bringing the virus. This was not the only person. I had another informant, another respondent who said they had a colleague who was forced to quit by her husband because of this same concern. And so these are really important issues for our community as well. And then one other thing that I thought was important is that they learn the importance of work-life balance. So a lot of these workers also started coming out of it thinking that they're more aware of the importance of friends and family as opposed to just being at work all the time, which I think has been a lesson that is coming more and more apparent for workers in general after the pandemic, especially people who have been in the professions less time because of that challenge of being in work and having to face all these family issues. And then turnover and tension, I was shocked by this one because I surely thought, there's been a huge exodus of people leaving the workforce and this is bad. And there was a lot of problems, especially with a heavily female workforce. Like, are we going to be made to quit because we have to take care of our kids, X, Y, and Z. And so I wanted to give you the nice things first. Most of them said, no, I'm not leaving, which was good. It was good. I was happy to see it, and the majority of them that said I'm not going to go anywhere. This quote really encapsulates it. I love my job. I had to stay. The people need health, and they need to be safe. So there was this huge reinforcement of like my work matters to this group, and they knew that what they were doing had that direct impact. Even though the majority of people had probably never met the person who tested their COVID test, um, they knew that they mattered. So that was a great thing to hear from them. One thing that I also found, especially with this group, was that they had invested time in their current role, and so that's the only thing they feel like they can do. And so that's interesting for a health professional perspective, that for them they've become so specialized and so niche that this is the only job that they see themselves doing. So whether it is here or somewhere else, that's what they're going to do. And then one last thing was the guilt of being left behind. I mean, the only person holding the fort. And that is obviously a huge problem in rural communities, where if you had, again, 3 laboratory professionals and one of them leaves, you can't leave. Now you have 2 12-hour shifts until someone else comes in. So that's one of the things that was, a reason to stay. Was like, oh, this is actually a yikes. Now, considering leaving, obviously, this being scared of the virus was a huge one. But then, of course, pay came out. And pay and benefits, pay, no time off, no adequate pay were huge for those who had said they were leaving. There were some that said they wanted to be able to reconnect with their families, and the work didn't allow for that. And then again, mental health coming along and saying being stressed. So this person actually said that they quit because after they were sick with COVID, they just were too stressed to go back to work. Which again, depending on how the management handled that, you could see these two groups, and I have additional analysis on that, but we'll talk about later. So to wrap it up, management practices. What was the good? What are the good things that management did? So if they were in a good place, they were helping their cover the cost of health issues and providing therapy. The majority of people who said they would stay and things were okay is because they actually had access to therapy and resources, and they felt like their management was encouraging to do it, take time off, take advantage of the resources, create a flexible work schedule, actually getting a bonus, which was not something that was possible for everyone, but they actually felt like that was important. And then obviously having clear access to cleaning supplies, PPE, and protocols that would safeguard their health. If they felt like the management was doing these things, they most of them would be like, I'm not going anywhere. Whereas oh, before I go to the bad, there's a couple of quotes from them. They have been very supportive and understanding. The word supportive was consistently present in those people who said, I'm not going anywhere. And so that support from management is key. And then one of them actually said that the management went out of the way to have a separate place for the COVID specimens. Because I don't know about you all, but there was a time, and during the first crazy times, where laboratories would just have buckets full of swabs, and you didn't know if that swab was COVID or not or whatever, and that was a huge concern. And so for them to be able to make sure that, oh, we're keeping that somewhere else and you're safe, that was something that was meaningful for this person. Now, bad things that management did that made people be like, I'm out of here, is obviously poorly maintained equipment crept up again 10 years later. If you don't have good equipment, why? Because then you can't do the job that you need to do. The distancing policies were a problem, especially for smaller facilities, because you can't be 6 foot away in a tiny room. And then difficulties with communication. So bad policies implemented protocols without actually explaining to the departments what was going to happen. Understaffing and lack of additional pay, despite the additional work, was a challenge. And so I found, when looking at shifts, workload, and pay, I found this all coming together in what I want to call the fuzzy work shift. And so the fuzzy work shift in this environment means you have a unplanned staffing shortage because somebody called in sick with COVID. And now the management is just going to ask the person, just go from 8 to 12 hours. Just you gotta stay. And that happens in emergencies. That is something that we're acutely aware of as healthcare professionals. but that became the norm for a lot of them. We just couldn't keep working. And there were people who were saying there was no shifts. Like they literally got rid of shifts. Like you come and you work and you stay and you get all these extra hours. Then there was also very interestingly laying off people because of the cost. So cutting costs by laying people off. So the key personnel was kept, but then other people were laid off. And when I say other people, I mean staff that, for example, mans the front window to receive specimens, or the people who are processing the stuff that's coming in from the tube stations. Those individuals are not necessarily certified or trained to perform the testing, and thus they would be the more fireable. And so that was a problem because then the scientists would have to do everything. And then management making workers work extra hours without being paid was a huge problem too. And the last thing, the inevitable in any situation with a pandemic is not being prepared. And so there was just not preparedness for this in these institutions, especially the closure of lab suppliers for the things that they needed, keeping a small stock of things because, you don't use it a lot. And then now the supplier's closed and now you can't get it at all, which was a huge problem. And that was also associated with the supply chain issues that we all saw. And so needing to send things out started to become a norm, which becomes very expensive for the laboratory that is actually sending the stuff out because they don't get reimbursed at the same price. And so they were saying that in the rural environments, we would have to just send the blood out to the urban areas because we just didn't have enough reagents and things like that. And so moving forward, I just wanted to leave you with a couple of different thoughts from my participants. Some of them mentioned the loss of our colleagues and that it was very scary, and also for us as well, even though we were not in the front lines, but a lot of people would say, I feel like we were, but and then that the pandemic did more the harm than good to the laboratory because people died. And so obviously that made people want to quit working in healthcare. And so those are huge concerns that still I feel had not been quite fully addressed with any healthcare professional. I mean, there's been work going on, but particularly for laboratory professionals, I don't see that there has been a lot of effort to just engage with them in that level. Then some of the other messages that they said, what have we learned? We'll be ready for anything. There were actually several people that said, we're ready for the unexpected, we're ready for anything. And then some of them were actually very optimistic. They were like, the pandemic has shown that the laboratory is a crucial member of public health and that laboratory professionals are valuable and that we should be treated well. And so those were things that kind of encouraged me, especially again, when I saw that a lot of them said, I'm staying, I'm not going anywhere. So that's a good thing. And that's something that I feel we need to kind of harness that energy of that positive, like, yes, it sucked, but I'm going to stick it out because I'm needed and I have a passion for this. And with that, these are my references, and I will be glad to answer any questions you have.
Well, first, thank you so much. I know that Alan is going to be switching devices, but I have a question from him in case he wasn't on when you ended your presentation. Well, have you been connected to the Center for Rural Health in Salina?
Not yet. I
Okay.
had made a proposal last year to actually visit like in person several of these I do have some rural contacts in Kansas, and so it was scored well. I've been fixing it up to try to go out and send it again to try to actually physically go and make some of additional characterizations for that. So I haven't had that direct connection yet, but I'd be glad to have that. That'd be great.
Yeah, I think we need to make that connection happen with Dr. Mosier there because it sounds similar to a project that he was working on as well. So I think there's definitely some collaboration that can happen there, like just immediate collaboration that I can see. And I don't want to take up all the time. So I see, Emily, you have your hand raised because I can always just email her if I have another question.
Well, that actually was one of my questions, so I'm glad you asked it.
Okay.
The other question, though, that I had was just, thank you so much. This presentation was super interesting and feels relevant in so many ways beyond COVID, just in terms of, workplace environments and urgency and being prepared and that kind of thing. And I'm wondering what you're thinking as far as where you want to take it, like where you want to go with it, and part of that is because parts of what you were talking about remind me of somebody that might be an interesting collaborator with you here on the Lawrence campus. But I don't want to steer you in a way. So that's why I was curious what you're thinking next.
Oh, no, that's great. I appreciate that. So actually, one of the things that I noticed in my research as a whole, and then also here in particular, is that the number of individuals that work in the laboratory that belong to historically underrepresented and minority groups is actually growing. And the education level is also growing. And so right now in nationwide, the two groups that have grown the most are Asian and Hispanic or Latino for laboratory professionals. But during my research, I did encounter a number of international or non-US born laboratory professionals who are certified and who do work in rural areas as well. And so I actually am interested in looking at uh, this passion concept and the intention to stay regardless of the craziness. Because I do find that it's in face of trauma, the resilience and the growing out from trauma phenomenons, particularly in populations that don't have those role models, would be a really interesting group to kind of harness because with time, more of these workers will come into the profession. And so my biggest my long-term passion is if you're coming into this profession and you enjoy it, you should be able to stay, and there shouldn't be any of this, outside work crazy forces that kind of pull you away or kill your passion. And so my hope is to take it into understanding better, particularly individuals who are, and just anecdotally have 2 or 3 examples of colleagues who are the only African American woman in a whole lab of like 15 people, and like she loves it, but she faces a lot of challenges, and how people like that just continue to navigate and grow from that, and how can we replicate that elsewhere, particularly again in places like rural areas where you have such few people who want to or able to work there. And so to me, that's where I'm based on what I've looked at, that's where I'm probably going. The laboratory population itself has shrunk 50,000 people in the last 10 years. I believe that's mostly retirement, but also some turnover. And so that's, I think, by looking at it as it happens, I'm hoping to build that stamina for the population to actually grow. We need about 23% more people by the end of the decade, so not less. So yeah, I'm hoping to take it in that direction, be able to better understand how this racial, ethnic minority, and underrepresented workers, how they channel their passion to stay in the profession.
Thank you.
I guess. Oh, Tamara, you have a question?
I do. I have 2 questions. So thank you, Leti. This was incredible. It's so important to hear perspectives that we don't often get to hear. And I had 2 questions. One is, now I'll admit this was about 10, 20 years ago that I would see these, they were like booklets about rural health in Kansas and how they were trying to recruit doctors to work in rural areas. And I'm just curious if there is an attempt to do the same for lab professionals. So that's one thing. So maybe there are incentives. And then secondly, in terms of these labs that you're studying, are they all the same model of lab, or are there like private sector labs or in public sector labs, a university lab versus a Walgreens lab? And are there any differences there? Are there some labs that have a better management model than others?
Oh, thank you for that. So I'll answer the first question first, which is the recruitment part. So I'm actually going to a recruiting event in Manhattan. It's a HOSA event. It's a high school students But so we're trying to do a little bit more of that. Unfortunately, state of Kansas only has 3 bachelor level training programs, and I think like a handful of associate level training programs for laboratory professionals, and they're not very well known. So, and they're not located in many areas. The KU program had actually explored the opportunity to have some training in Salina a few years back, but then COVID kind of killed that. But I will say, coming from another rural state like Arkansas, where I worked, also as faculty, we had a hybrid program where we would have our learners come in for targeted education at the main campus, but then we would facilitate their rotations at their or the closest facility to their home place. And so we would even set up residency or rotations wherever they were so that we could facilitate that pipeline. And if you look at their model right now, they're also encouraging people to go from a 2-year degree to a 4-year degree. I mean, Arkansas is just being served really well by that program. I wish that Kansas would replicate something like that, because that would definitely help grow the workforce. Definitely taking the program further west to somewhere like Salina would be a huge accomplishment. Our problem mostly is facilities. We do have to have fancy equipment and at least lab space, and space is always a concern. We can teach our lectures online through teleeducation, but the actual hands-on and teaching a person how to perform those hands-on skills is what one of the biggest challenges is. And then, oh my God, your second question was, I should have written it down. Sorry.
That's okay. And I don't know if it's really relevant because I don't know if university labs are for profit or not, but I was trying to make a distinction between different kinds of labs, private and public, if that's even applicable, and management styles.
I appreciate that. Yeah, so it depends. I mean, mostly for the purpose of laboratory workers, for profit, outpatient, like things like Quest or LabCorp, those big box labs. There is some distinction. There qualifications for people performing laboratory testing, and I don't want to scare anyone. This is an unlicensed profession in the majority of states of the United States. That I feel like there are 11 or 12. One of them is about to lose their licensure. I think it's Tennessee. Rhode Island lost its licensure. So you could have an unlicensed professional telling you that you have cancer. That is I mean, not telling you, but actually doing the test, that somebody else is going to tell you about. And so that's been a huge fight and a huge challenge. Certification is what has been the more applicable, the more, okay, let's push for people who are certified. And so those larger big box laboratories can get away with fewer certified individuals doing a lot of the work, and then having the certified people like at the tail end, kind of like making sure that the wheels are not falling off. So those management models do vary depending on the size and the place. So that's one of the reasons why I would love to actually go. I trained in a rural hospital during my time as a student, and it was just an awakening. So to me, just have had that experience and know how different it is, I can tell you it is just a one of those things where you got to go to the side to really understand it. But yeah, I appreciate that question. Sorry for the long-winded answer. Sorry, Terry, you have questions. Sorry.
Yes, Letycia, thank you so much for this presentation. So just a couple of thoughts. One is, you probably know this based on your research, but health and social care providers had been dealing with burnout and all of this prior to the pandemic. And so the pandemic sort of brought it to light where it became known by the public. So there are some really good resources, as you're probably aware. U.S. Surgeon General has a couple of reports. In Kansas, the AHEX and the Office of Continuing Education Professional Development have also done some training on workplace trauma-informed care. So not just trauma-informed care for the people we're working with, but for the workers, so that it's a trauma-informed organization. And that might be something. And then sort of back to a conversation at the very beginning of this, and I'm looking at Tamara because she was talking about mentoring. I'm curious, in nursing and in social work, that first year post-graduation is often the time that people leave the field. And I'm wondering if you have any information about, does that apply also to labs, medical lab science, and whether there would be an opportunity for some kind of a mentoring outreach within the profession that might help bridge that real vulnerable time frame. So just a couple of thoughts.
Thank you so much, and I appreciate that. I do know that I have had some interest in trying to not just measure burnout, but actually implementing some strategies. One of our national societies, the American Society for Clinical Pathology, has had webinars and things like that. But unfortunately, the participation of the population in professional societies is not as high. Most of us become members of ASCP because they are a certifying agency, and once the year is up, we don't renew because it's expensive, which is a lost opportunity, honestly. As you may know, it's actually I work with them, and they have about a database of about 95,000 people, but a lot of them are vendors and like people who are older and have found the benefits of being in a professional society. So I think that with what you mentioned of that vulnerable time of those first couple of years, I will echo that. And that's one of my biggest, like, I don't like to call it my battle after being an instructor. It's like, how can I like teach these people and then send them into, to just be sad and not have a fulfilling career. So right now, what a lot of people are saying is, and we've actually seen this, Kansas is one of the 3 Doctor of Clinical Laboratory Science programs in the country. And we are actually seeing a number of our former grads becoming interested in that, because that allows them to use some of those skills that they've acquired in their work as laboratory professionals to actually help inform additional decision making. And so with this kinds of degrees, the loss of those first 3 years is still high. So I think, as you say, implementing some other strategies, I think particularly at the education level, but also just the learning opportunities are not quite there. Managers don't pay for CE as they should. They don't encourage people to learn more or grow as much as they should. And I think that's a lost opportunity too. So hopefully we can implement some of that too, and that will help in the long run. I do know a lot of people have stayed longer than I thought they would. So interesting.
Well, in the interest of time, it is 10:01. If you have any events that you'd like for us to promote through Frontiers, please drop them in the chat or email me. As mentioned in our last meeting, the MARG Bulletin is back and running. So if there are events, please share them with me so that I can put them in the newsletter. I cannot thank you enough for presenting. I know how crazy your schedule is, and so I appreciate you carving out the time to present to us. And I hope to be able to make that connection to Dr. Mosier very soon so that you can have that connection. And I think Emily said she was going to email you as well about some things. So this is what the MARG does. This is exactly what it's here for. So I won't end the meeting. I'll just stop the recording. So if there are things people want to drop in the chat, they can still continue to do so. For the rest of you, have a great day and enjoy this hopefully sunny weather today.
Thank you all.
Thank you.